What do you do when you're on a plane and need to pop your ears? Swallowing usually does the trick, because it slightly opens up the eustachian tubes. Well, the same happens when a baby sucks on a pacifier. But babies' eustachian tubes have a different shape than ours. They're flatter and shorter, which makes it easier for microbes to travel from the nose to the ear, especially when they're opened up after long periods of sucking. Already in the 90s, researchers had shown that children who use pacifiers had more ear infection than those who didn't. However, a more recent study observed that pacifiers increased the risk of ear infection only for children who had already had one. That's because the first infection is likely to damage the protective mucosa of the middle ear and eustachian tube, making recurrent infections more likely. According to this study, if a child has never had an ear infection, a pacifier will not cause him to develop one. But if a baby has had one, a pacifier does increase the risk of a second one. Stopping a pacifier habit can be hard, especially when your little one is sick. Many pediatricians recommend weaning babies from pacifiers in the second 6 months of life, whether or not they have already had an ear infection. Most babies will have an ear infection sometimes before they turn 3, so this recommendation makes sense. Whether or not you decide to start weaning your child before her first ear infection can also depend on other risk factors, such as going to daycare, bottle feeding, or secondhand smoke. The other reason to wean a baby is the effect pacifiers can have on teeth. Several studies have shown that pacifiers used beyond 2 years can be harmful to the developing dentition. If continued after 4 years, the effects are more severe. It's also worth noting that orthodontic pacifiers only moderately lower the risk. Sometimes a baby who was previously sucking on a pacifier will start sucking her fingers. This probably indicates a need for non-nutritive sucking. Incidentally, babies who are breastfed for at least 12 months are less likely to engage in non-nutritive sucking after 3. If it does happen, try to monitor when, how often, and for how long. Little Emma tended to suck her thumb every time she would be among people she didn't know. After becoming aware of this, her parents started to prepare her to meet new people by telling her in advance who they were going to meet and giving her some descriptive details to help her get to know them. It went like this. Lisa will come for tea tomorrow. She has curly hair. Do you know anybody else with curly hair? Your friend William also has curly hair, right? Lisa loves books. Maybe she will read you a story. Would you like that? Even if Emma doesn't yet understand every word, repeating this several times in preparation of the meeting helps her feel more secure when she meets Lisa, therefore addressing the trigger rather than the thumb sucking itself. Several studies show that thumb sucking is not in itself worse than pacifiers, but it may be harder to stop. And the longer the thumb or pacifier sucking, the more likely the impact on dentition. The bottom line is that there are very good reasons to stop giving a pacifier during the second 6 months of life. This can be done very progressively, especially if the baby hasn't had any ear infection. If you enjoyed this video, don't forget to click the like button. And if you would like more, share and subscribe to this channel.